Appendectomy.
Yes.
Just if you were to break it down briefly, because it's just also something that I've never understood, because like even for my case, I got it when I was very, very young.
Yeah.
So what could be like the major cause? Maybe is it lifestyle? Is it genetics? Or where does it come from? Where does it stem from?
Now, see, it's poorly understood what exactly causes this appendicitis, that is inflammation of your appendix, but most of the times it's a form of infection. Now, appendix is a vestigial organ. Vestigial organ means that our ancestors needed it for digestion, but in today's era, we don't need that organ for digestion. So it has reduced in size significantly. It lies in right lower part of your tummy. Not having much functions, although a recent study suggests that it do have some immune function. It helps us in some form of immunity, but not yet very well established. There is partial evidence that it may play a part in your immunity, but because of some infections, it can get inflamed. When it gets inflamed, it gives you a lot of pain. It can lead to sepsis, and if not treated, it can burst, which can lead to severe sepsis and shock as well. That is why whenever an appendix gets inflamed, it needs to be removed out so that you prevent that sepsis.
But now, like also with something like that, especially let's just try and imagine people who are in upcountry.
Yeah.
How easy, like, or like how can like even just parents detect that, like on children or teenagers? Or even like some adults might not really pay attention to. They just think like it's a stomachache, take painkillers. You know, it's not easy for everybody to just walk in hospital and admit they have like actually a problem. But what should be concerning to people before they?
First thing it will give is the severe pain. Initially, it starts with in central part of your tummy, and then it moves to the right side. So that gives an idea that this could be an appendicitis. It can be associated with vomiting, fever, those things. So if pain is associated with other symptoms like vomiting, fever, diarrhea, always go to hospital as soon as possible, seek a doctor so they can run your basic test and they can find out if it is appendicitis or no. Now, it used to happen in past, but in today's era, we have seen very less cases that when the appendicitis has been missed. So it used to happen around 20 years back.
Yeah.
But today, the availability of this blood test, ultrasound machine is also very common even in upcountry.
So even blood tests can actually detect and show you?
Blood test will give you an idea. If you have pain in right lower tummy and it's associated with raise in the infection counts on the blood test, we assume that it should be appendicitis. And ultrasound nowadays is widely available. Now, although the better test for it is a CT scan, which is available in most of the big cities. It may not be available in upcountry, but basic ultrasound, nowadays it's available most of the places.
You've mentioned ultrasound, and again, this is coming from a layman's perspective, right?
Yeah.
When you mention ultrasound, I just know it as a pregnancy scan.
Okay.
That's all I know. But what else is involved, or how else is it used to?
Ultrasound is just a scan, which has a probe which you put on your tummy or the area where you want to see the things.
Yeah.
It will send ultrasound waves that gets reflect to the probe. And because of that reflection, there is difference in reflection. You will see a black and white picture on the TV.
Of like actually the organs.
So it's not just about the pregnancy and to see the baby. It can see your other organs like liver, kidneys, everything.
Okay.